Hello, my name is Dr. Patricia Sullivan, and I'm excited to be here for about my 10th trip here to Nepal. I began my experiences here in Nepal about 6 years ago when I first met Shambhu, who is a physical therapist here at the faculty at Kathmandu University. He was a doctoral student at Mahidol University, where I am a visiting professor. He asked if I would come up and help the faculty here and teach workshops here to the physiotherapists. So I've been doing that for about twice a year for the past 6 years. In 2015, when you had the huge earthquake, we realized that more was needed than just coming up and doing workshops. So with the help of Govinda, who is another one of the physio faculty, we developed the concept of a rehab unit here in the hospital. As you know, out in the communities in the rural areas, there is very little health care provided. Dhulikhel Hospital has established up to about 20 of these community centers.
This project has also set up the physiotherapy clinic in 6 outreach centers of Dhulikhel Hospital. They are in Bolde, Balwa, Baunipati, Manikharka, and Kirneta and Thangsing, and these are different in different districts. Mainly physical activities they do in the field, and they carry the weights in their neck and the back. That leads in the neck pain and the back pain. With the aim to improve those things, we have set up the physiotherapy clinic in community.
The therapists out there have done an amazing job in the past 4 months, and they've done something like 700 treatments, visited many patients in their homes, conducted educational sessions for pre- and postnatal women, for elders to work on fall prevention, and then general health care. So they have been unbelievably successful, and we're very proud of what they have done.
One of the patients that we met in Balwa Health Center was Kumar Shrestha. He is a 70-year-old male who suffered from stroke 4 years back. He had suffered from right-sided weakness and speech difficulties. The first time that we saw him was 4 months ago with chief complaint of right-sided weakness, and he wanted to speak to his companions, but he couldn't. The improvement that we've seen within these 4 months are that now he walks a lot better than the first time that we saw him, and he is now able to pronounce a few meaningful words like asking for food or asking for water, and he can sing a song that he loves to do during the day.
In context of community, we are facing difficulties or barriers as well, because they lack the health education. They don't know much about the health system, how does it work, and they are mainly depend upon the traditional medication. And for them, the physiotherapy exercise is a new technology or new term in the medical field, so they are a bit hesitant to do the exercises, and we have to tell them the difference between the physical activity and the exercise, and how exercise helps to prevent and then overcome their problems.
He is Vishnu Danuwar, 24 years old male with brain infection 5 years ago. We met him in Balwa Outreach Center, where he was brought by the family members, walking 45 minutes far from his house. While we met him, he was unable to walk and stand independently. He needed 3-person support to walk and stand. Then we decided to do home service for him. In the home, we made him do the functional activities, strengthen his lower extremities. After the 4 months of the treatment, we found out that he is able to stand independently with the help of the stick, walk in the parallel bar, and do his almost all of the activities of daily living independently.
With the help of the Dhulikhel Rotary, we created a Rotary Foundation grant that equipped a subacute unit at Dhulikhel Hospital and at 6 of the community facilities.
Talking about subacute unit, it's a minimal care unit, or let's say it's a transition phase where a patient admitted in an acute care setup like hospital, which are medically and surgically stabilized, are transferred to subacute unit for extended physiotherapy care. Neurological cases like stroke, brain tumor, which are surgically stabilized, has been treated by us, and it has shown a better result because like early physiotherapy care in subacute phase, so quicker recovery.
So patients that have had a stroke and need some rehabilitation prior to going home, patients who have had a spinal cord injury and are coming back to the hospital, maybe for wound care or for a bladder infection, can have rehabilitation done in the subacute unit.
Major challenges that we have been facing are like people are less aware about subacute unit because it is a new thing in Nepal. So we are trying very hard to make people aware about that, and we are trying to admit more variety of cases. Lots of cases like fracture, child with developmental delay are also benefited with this setup.
In conjunction with the Rotary grant, which provided funding for the physical therapy equipment in these sites, I developed a foundation, a charitable foundation, which in the United States we call a 501c3 for tax purposes. And that allowed us to pay for therapists to work in these facilities. So what we have been able to do in the past year has been phenomenally successful. Starting last January, getting equipment in all of these 7 venues, having a 2-week vocational training team experience here in April, and we'll be conducting workshops here at Dhulikhel Hospital and also out in the community. So at the end of this year, this project will be wrapping up. The sustainability will be ensured, and so this has been an extremely successful marriage between the Rotary project, the Rehab Nepal, and Dhulikhel Physiotherapy. So in all, we're extremely proud of what we have done and the collaboration amongst us all.